Hello and welcome to our YouTube channel. Thank you. We have Dr. Mehra again. Thank you, Dr. Mehra, for being us with us today.
Thank you for having me, Dr. Kashyap.
Absolutely. And the reason we're recording it again, because based on our last discussion, we had overwhelming response from all of you. And it's so we are touched by that. And there were some questions came up. So we just want to provide some clarification. But Dr. Mehra has come up and I've taken the liberty to volunteer myself to answer some of those questions. So please go ahead, Dr. Mehra, what questions has come up regarding the COVID-19 review articles research?
So the first question that I have been receiving overwhelmingly is what we're doing a systematic review?
That's a good question. So systematic reviews, the strict criteria for systematic review is that you have to have one particular intervention or treatment in mind, and you're looking in that particular patient. So thankfully or sadly, our patient group is same. We are talking about COVID-19 patient population, but at this point, we will be looking at different intervention, different novel therapies. It could be antiviral, it could be anything else for that matter. So what we'd say that if we say systematic review, this is a loose term, we'll be using it. More likely it'll be a review article. So more than one review article, we can focus on different areas as well. So I would say it's going to be a review article unless we have a solid clinical data coming out from particular therapies by the end of this effort. Then we can move those papers into systematic review papers.
Got it. Also, since this is not exactly a systematic review, it is a review, but we're focusing on a specific population and intervention. Like you mentioned, we're talking about interventions ranging over different kinds of therapies. So what are the particular outcomes that we're looking at, and what are the usual comparison groups that we should be looking at?
So mostly at this time, they're opinion articles, or people are speculating this will work, this will not work. But hoping as you continue to do that over the month in April, as we start getting some of these things coming in, idea is that each article should have their intervention group and control group. So there'll be there
Mhm.
the people who did not get that kind of intervention, or if they're doing a historical cohort, which is a poor study design. So we will look into those as well. So if you follow the PICO guidelines, which we teach everybody, patient population, what is intervention group, what is your control group, and what is the outcome. So intervention outcomes are coming out from those papers, and then we follow that. Outcome is simple. Any hospital outcome would be okay. It requires decreasing viral load. That will be a good outcome. It requires disappearance of the symptoms. It can have complications development in terms of ARDS and acute kidney injury, acute respiratory syndrome, shocks, sepsis, pneumonia, multi-organ failure. It could have mechanical ventilation duration. It could have hospital duration, hospital length of the stay, ICU length of the stay, ICU mortality, hospital mortality. Or if somebody is looking into and they're publishing as a post-ICU outcomes or post-hospital outcome of 28 days, 3 months, 6 months, that's a fair game. So I would say any patient-related outcome would be a fair game for this review article.
All right. And in the population that we were talking about, we don't necessarily have to limit ourselves to critical care, right? We can talk about any adult hospitalized patient or any, like different various groups that we have that we're seeing.
Absolutely. I think this is not just the ICU patient, but most COVID-19 patients would be severely sick. So I would say 60, 70, 80% of them, if they're in hospital, they might be in ICU, just a
Mhm.
speculation. So I think you were wise enough to now add those data points saying if this paper or manuscript is applicable to pediatric only, adult only, or OBGYN or journal. So then we can differentiate these papers later on. We can create subgroups for you guys, and you can take a lead in publishing in those areas if you have that kind of training and expertise in the past. So
Mhm.
absolutely, it is applicable at this point. I know that we have done adult. If it's too much work, just focus on adult patients, and that'll be okay. But
Mhm.
imagine there's so many people have you joined us. We would like to distribute. We would like to have you succeed and take lead on it. So it's not be a bad idea to add that one point saying this paper is applicable in journal or adult population only, pediatric only, OBGYN, or anything you guys can come up with.
All right. That would be great. And one question that I'm most popular question is there any journal that we're currently targeting? Or should we be thinking about that at all right now, or just focus on the data collection part of it?
Yeah, this comes up more often than you think. So this is a valid question, but to even thinking and talking about it is putting the horse before the cart,
Mhm.
because we are just doing the first screening. Then you go into those detail of each paper, collect the data get analyzed. Somebody takes a lead in writing. I'm sure I have no time to write any of these things as a first author. You might be able to write the first one, but others you'll be writing as a first author. You write it, it goes through review process with other co-authors, and by the time you're writing it, then we'll talk about it. So I think it's fair to say most look like there'll be any hospital medicine, acute care, critical care, emergency medicine journals would be a
Mhm.
good fit. But
Mhm.
we will cross the bridge once we get there. But it should be done before you start writing your first word on the manuscript. We are far from there.
Yeah, absolutely. I understand that. And thank you so much for your time. Those were the questions that I had for now.
No, absolutely. I think you're doing a phenomenal job as per se, and then our team members. I cannot thank you enough. We got so many Twitter messages, emails, and your phone was pinged with all of these things. So this is
Mhm.
overwhelming response. You are helping being where you are. One thing I would add is that you don't have to work with us. You can come up with your own idea, form your own team, and look at these literature by yourself, and then go and succeed. We are just providing a framework. You work with us, you will get the success, and you can do it by yourself with other different ideas you have it, and forming the teams as well. One a quick pitch I will do it, and pay attention to it. You see the background in here, COVID-19 registry. We will put a link into this video. If you are in your places, wherever you are, if you want to enroll sites, hospitals, and ICU who are seeing COVID-19 patient anywhere in the world. Yesterday, one medical student, one USMLE aspirant talked to me. We said we can't have you here, but if you are in your country, if you can enroll five sites who contribute data to this registry done by Society of Clinical Medicine, I will be happy to write a letter that you contributed in that fashion towards your ERAS application. So that open invite is open for all of you, wherever you are. It doesn't have to be your country. You can reach out to somebody else in other country if you know them. If you sign up five sites for COVID-19 registry, actual patient data collection, uh, follow the link of SCCM, or you can look up SCCM COVID-19 registry and then follow the instructions for those sites. We'll be happy to have you on board, and that's where you can help out with patient data collection as well.
All right.
Thank you, Dr. Mehra, for this opportunity and leading this important work. We are very excited. And thanks for watching our channel. Please do like, subscribe to our channel. That's the only way we'll be recording these things, instructions, other ideas, where we are, and then anything else come up. So please do like, subscribe, and write and comment what you liked or not. Thank you so much for being here, Dr. Mehra.
Thank you. It's been a pleasure.
Stay safe all.
Mhm.